Hello, everyone. Welcome to another episode of Take Back My Brain. I'm your host, Laurie Hammer, and I have a repeat guest with me today, and I'm so excited because I just love her. This is Dr. Christy Sutton. She is a chiropractor in Dallas, Texas, and she is all about finding the root cause as to why you have, what your autoimmune condition, colitis, Crohn's. But today we're going to talk about her most recent book called The Iron Curse. And this focuses on genetics, environmental risk factors, and everything having to do with high and low iron and how that impacts your health, your immunity, your longevity, and everything in between. So, Christy, thank you for being on again. And I'm excited to have this conversation.
Thanks for having me.
Awesome. We were just talking before, and like we could just talk for hours. So we could just have
Mm.
like this big continuous live stream podcast for everybody to listen to about who knows what that these women's brains just kind of rabbit trail to. So but today I want to focus on the Iron Curse. So this is your latest book, and give me kind of a synopsis of the book and why you wrote it.
Yeah, so it's obviously about iron. The iron curse has to be about iron, I guess. So I talk about multiple different iron disorders, high iron, low iron, the root causes of it, the genes that you should know about, protocols and things you can do to protect yourself from high or low iron, and the important lab ranges, all of that. And the reason I wrote this book is because me being somebody that struggles with low iron because of Crohn's and complications and stuff,
Right.
being a female, I have always been interested in iron levels, and then um, married a man with undiagnosed hereditary hemochromatosis and helped him go through the process of getting properly diagnosed for that,
Wow. Hmm.
and realized really like what some of the myths are that are stopping people from getting properly diagnosed, and a lot of the hurdles that patients have to unnecessarily take to properly get diagnosed and managed and screened. And after walking my husband through that experience, I got much more savvy in my own practice with
Hmm.
identifying particularly hemochromatosis
Right.
issues, like diagnosing hemochromatosis.
Hmm.
And at that point in time, I had published my first book, which had a short chapter on hemochromatosis genes, and I had created the genetic detoxification report, which
Right.
had two of the hemochromatosis genes at the time. And I was using, that genetic report and labs on my patients whenever we could get that information. And I realized, oh my gosh, there's so many people with this undiagnosed issue. And then I would, get them diagnosed, also refer them out to, a
Yeah.
hematologist or whatever to get treated. And often it didn't go anywhere from there. Like either their PCP would chime in and say, don't worry about it, you're fine. Or like they just kind of were not interested in it, and or they couldn't get in with a hematologist in a timely
Sure.
manner, or they just didn't have the money to go see a hematologist because
Right.
um, you know, not cheap.
Right.
So and then I guess during all of that, my colleague who has a daughter with two hemochromatosis genes
Hmm.
was diagnosed, well, actually, she developed juvenile hemochromatosis, and
Okay.
um, we got to walk her through getting properly diagnosed and treated. And that was a catastrophe that, like, the only reason she got properly diagnosed and treated is because she was, the child of a clinician that,
Oh,
was interested in this. And so, and I tell that story in my book, and I'm happy to talk about that with you. It's kind of interesting, but a bit lengthy,
yeah.
that story. So that was kind of what made me sit down and say, hey, I'd like to shed some light on this topic,
Right.
to help people get properly screened for, diagnosed, and treated.
Yeah. Because I think when people think of iron, they're thinking, oh, anemia, right?
Hmm.
We don't often, I think hemochromatosis is becoming clearly with your book and other people talking about it. There's a lot more awareness about it. But, I've watched many people, trying to get that diagnosis, or they think they have that diagnosis and they're not able to find the right practitioner, they can't go get blood the way they want. There's just a lot of hoops that you have to jump through. And you have to be really creative. So can you tell us the difference between low iron issues and then issues like hemochromatosis and high iron, and kind of go from there?
Differences as far as like labs, or differences as far
Labs
as
and
symptoms, or
actually both. So let's start with labs, because I love
yeah,
talking
that's the
about
meat and
labs.
potatoes
It's the
of it.
meat and
I mean,
potatoes. Yeah.
yeah,
So you
I
get your
mean,
lab, you get your CBC. What do you do?
well, okay. CBC is important. You need the CBC because that's going to tell you your red blood cells, your hematocrit, your hemoglobin, and you need that information because if you're high in iron, you're more likely to have, although not always, you're more likely to have like maybe high red blood cells or high hemoglobin or high hematocrit or all three.
Right.
Um, if you are low in iron, you're more likely to have low red blood cell, not always, but you're more likely to have maybe low red blood cells, low hemoglobin, low hematocrit, low MCV. These are the
Mhm.
labs on there that we need to look at. Also, the CBC is important because that can kind of tell you in some cases if you're dealing with an infection.
Right.
If your neutrophils are sky high or your lymphocytes are sky high, then there's a good chance you're dealing with an infection. And in that case, your iron-related labs are probably going to be, they're definitely going to be affected,
Hmm.
and they're probably going to be temporarily an inaccurate picture of your normal iron levels.
Right.
Because like when you're sick with an infection, your body likes to take the iron out of the blood and put it into ferritin
Hmm.
to get the iron away from the infections and not be like fertilizer, because bacteria and viruses and
Right.
parasites, they like to
They
use
love
our
iron.
iron. Yeah, it's like fertilizer for
Right.
almost all of them, with the exception of like Borrelia and Lyme's disease. Um, but so, which actually, side note, likes manganese. So if you have Borrelia, don't take manganese. Um, but so, okay, I digress. So going back to the iron thing. So you've got the CBC and you need that. You also need that because if somebody does have hemochromatosis, which I'll talk about what that would look like on labs in a
Hmm.
second. If somebody does have hemochromatosis, then you need the CBC to tell you if they can have blood removed,
Gotcha.
because the primary treatment for high iron hemochromatosis, although there are many other treatments, which I talk about in the iron curse, the primary treatment is blood removal, because when
Right.
you lose blood, you're going to lose a lot of iron because a lot of the iron in our body is
Hmm.
stored in blood. And so in the red blood cells, because that's, the hemoglobin's in the red blood cells and it travels throughout your body. So when you lose blood, either through an injury or surgery or a GI bleed or menstruation or childbirth, whatever, you are going to be more likely to become low in iron and anemic. So, so that's kind of the CBC piece.
Hmm.
Um, if you see any issues on a CBC, like high red blood cells, high hemoglobin, high hematocrit, um, you want to make sure you get those hemochromatosis genes,
Right.
because over 30% of the global tested population has a hemochromatosis gene.
So say that again. How many percentage?
Over 30% of the global tested population
That's a
has a hem.
lot.
It's a lot.
Yeah.
And most of them are Caucasian.
Okay.
Okay. So like the same study that I cite that has the 30%,
Yep.
it was really an interesting study. They went and they looked at different countries, and Ireland has the highest percentage because those hemochromatosis genes, which they are important because they increase iron absorption, they originated in likely a Viking ancestor thousands of years ago. And that Viking ancestor was in that Northern European area
Mhm.
largely. And that's why the Northern European countries have the highest percentage of these
Okay.
hemochromatosis genes. But Ireland, and not just Ireland, but Scotland and England, all of the United Kingdom has the highest percentage because those genes were brought there early on, and then they were in an island, so inbreeding,
Sure.
okay?
Sure. Makes
And
sense.
then if you add on top of that the Irish potato famine, which, oh my gosh, if you call it a famine to people in Ireland, they get really mad. They like to call it a genocide
Yeah, it was far worse than we were taught.
because I learned this.
Yeah.
I'm gonna go on a tangent here, but it's an important tangent. I learned this. I posted this video on TikTok and it went viral, and I woke up one day and I had hundreds of angry Irish people
Really?
because I was saying that the reason Ireland has the highest percentage of this hemochromatosis gene is because of the Irish potato famine. And they were like, it wasn't a famine, it was a genocide. The Queen of England took away our food. You know, the potatoes died because of a blight. Apparently, the Irish people were like forced to grow this one potato. And
Hmm.
then the Queen came in, and during this potato blight, where all the potatoes died, the British came in and they took away their remaining food, like their crops and their animals that they would eat, and they even prevented them from fishing in their own waters. Like they're so this was interesting to me. So anyways, during that Irish potato famine genocide, whatever you want to call it, um, a couple things happened. One is the people who had the hemochromatosis gene were more likely to survive.
Wow.
Yeah, because they were less likely to die of iron deficient anemia and fatigue.
Oh, uh-huh.
And because when you're in the middle of a famine and there's not enough food, you become deficient in all
All
nutrients,
nutrients. Yeah.
but particularly important for survival is iron. And so the people who had this gene were more likely to survive. And so it was like this genetic bottleneck where the Irish people already had a large percentage of the hemochromatosis gene in their population. And then the people who survived, they were more likely to have the gene. So after that famine ended, it lasted for a number of years. I want to
Hmm.
say like almost a decade. During that period of time when it was over, there was an explosion of people with hemochromatosis because genetically those who didn't have the gene died off at a higher
Interesting.
rate. And then you get more people with two hemochromatosis genes, which makes you even more likely.
Mhm.
And then don't you know, like if you go through a famine after that, you're just like, give me all that food. I'm going to eat so much, you know?
Right, right.
Um, so anyways, that's that. The other thing that happened that's very interesting is millions of people. So I can't remember the exact numbers of people that died because during that famine in Ireland, but I want to say it was like between 1 to 2 million people. That's a lot of people.
That's a lot of people.
But also, over 2 million people moved from Ireland. Largely, a lot of them came to the United States.
Mm-hmm.
So the people that came to the United States were healthy enough and strong enough, had the ability and the wherewithal to come here, and they brought their hemochromatosis genes with them.
Okay.
And so the American population, even though it's, kind of, we're all over the map as far as,
Melting pot. Yes.
melting pot, total melting pot, the Irish Americans largely, and Northern European Americans, European American, they largely have that hemochromatosis gene more than anybody else. And
Interesting.
they have inbred with all other different races. So now, like, I'll see that gene in people from, all different ethnicities,
Mhm.
Hispanic, African American, so it's certainly it needs to be on your radar as a practitioner for
Right.
sure. And if you're Caucasian, especially Caucasian Irish male, for sure. So,
Hmm.
so you want to have those hemochromatosis genes. And there's three of those genes you want to have. And I have all three of them now on the genetic detoxification report, but you can also order those through, LabCorp or Quest. Um, it's interesting because if I order those three genes through LabCorp, it's over $300 just for those three genes. But
Wow.
then I know that's a lot
That's a
because
lot.
then you can go to like these direct to consumer testing companies and get tons of different genes for $200.
Right. Right.
So, but it's nice to have options.
Hmm.
So, okay. So going back to your original question of the labs, the CBC, and then the other thing you absolutely need is the iron panel.
Which most practitioners aren't running. Yes.
Yeah.
Hmm.
Yeah. The CBC, everybody's running.
Right. Because it's like $12, so everybody runs it.
Well, and that's also just a part of like the insurance paradigm.
Correct.
Go to the doctor, you're going to get a CBC,
CBC.
a CMP, a lipid panel.
Hmm.
Maybe if you ask, they'll throw in a vitamin D or a
Maybe. Yeah.
ferritin,
Hmm.
maybe your analysis, maybe. But like it's pretty underwhelming.
Right.
So, but the CBC is commonly ordered, and the problem is that um, a lot of times the things that are out of range on the CBC are not really looked into. They're often overlooked, like, oh, your red blood cells are high. It's okay. Don't worry about it. We don't need to like order the
Right.
iron panel or whatever. Or
Right.
like they'll say like your red blood cells are low, you need to take iron. And it's like, because I'm sure you've seen that as a clinician. I've seen that as a clinician. Certainly somebody that comes in shows me their labs that their doctor ordered, low red blood cells, says, my doctor told me to take iron. I'm like, I have no idea if you need to take iron. All I know is that you need an iron panel because
Yes.
if you have low red blood cells, it can be because of low iron. It can be because of many other things too.
Hmm.
So, like this one particular woman I have in my thought right now, I'm thinking about. So she had low red blood cells. Her doctor told her to take iron. We ordered the iron panel. She doesn't need iron. She absolutely does not need iron at all. And so she would have been taking iron with no real need for it. And then eventually, like her red blood cells just come back up and, it's kind of over. But had she been taking the iron, she could have become high,
Right.
postmenopausal female. So,
Right. Right.
okay, so the iron panel, most people are not getting run on them. And it's not like an exotic test. I mean, we're talking about an inexpensive, easy
Yeah.
to run test. And but if we're just not doing it, it's a blind spot in healthcare.
Mhm.
So what is the iron panel? So you have a ferritin, which is like your stored iron, which can also be an inflammatory marker. So you can get, a high ferritin because you're inflamed, because you have an infection or whatever.
Right.
Or you can get a high ferritin because you're just really high in iron and your body's been storing a lot of it. Um, so the ferritin's important, but you don't just want to get the ferritin. You want to also get the TIBC, the UIBC, the serum iron, and the iron saturation. And the most important things out of those for diagnosing hemochromatosis are the iron saturation and the ferritin,
Hmm.
because the technical definition diagnosis of hemochromatosis, which is iron overload, too much iron, is you have an iron saturation over 45%, which 45 by most lab ranges is much lower than the lab range flags.
Right.
So like I the lab range that is for the labs that I run, it's usually allows to go up to 55. So 55% for the iron saturation. So I just have to keep like a mental note, like, okay, 45 is the cutoff. And that's until the lab range is changed, that's just what everybody's going to have to do.
Sure.
but then you have to explain it, and patients, if they don't see it out of lab range, they're kind of like, are you just being anal retentive, or like, is
Right.
this an actual problem? So there's the iron saturation, and then the ferritin. So if you have an iron saturation over 45%, and this all needs to be done fasting. If you're looking at iron saturation, it needs to be done fasting.
Yep.
And then you get your ferritin in there. And if your ferritin's high and your iron saturation's over 45%, then that's hemochromatosis.
Okay.
And if you throw a hemochromatosis gene in there, that's hereditary hemochromatosis.
Okay.
Now, the issue is ferritin ranges. So the ferritin range for labs, I think, is too high. I think they just allow you to go too high.
Mm-hmm.
So, like me personally, based on the research I've done, which is pretty extensive, I don't really ever like ferritin to go over 100. Okay.
Yeah. For men
Uh,
and women or just women?
for men or women.
Okay.
If somebody has a history of being diagnosed with hemochromatosis, um, they they likely need to be in an even lower range to be managed.
Okay.
And hematologists that are managing hemochromatosis patients will often keep their patients like below 50 on ferritin. Okay.
Okay.
So everybody's kind of different, but if we're just kind of trying to look for a range, I don't
Mhm.
ever like it to go over 100. Now, for like an adult woman, often the range will allow you to go up to 150, sometimes 200. But in my opinion, like if somebody has an iron saturation in the 40s combined with a ferritin like near 100 or above, my alarm bells are going off like, do they have a hemochromatosis gene?
Mm-hmm.
And if they do have a hemochromatosis gene, then I'm like, you get the lecture. You get the hemochromatosis lecture.
Uh-huh.
And maybe they feel it and they, really take it to heart. And, or maybe they just say, you're overreacting and I'm going to go get a second opinion from my PCP or whatever. And then often, nothing happens. The problem is that most people that have hemochromatosis don't get diagnosed, and those that do, it takes over 10 years.
Mm-hmm.
And so my warning flag being dismissed, they might not ever get diagnosed, or it could be 10 years later when they have, permanent damage, maybe,
Right.
cancer, who knows, because that
Mm-hmm.
can happen. So now men, the ferritin for men often goes up to 400 or so. Different
Right.
ranges have different numbers, but that's outrageously high in my opinion. Now, okay, there's a study that I reference in my book, and they look at the ferritin number and they start at 200 and they go 300, 400, 500, 600. And then they have life expectancy. And the higher the ferritin at every 100 interval, the lower your life expectancy. It's a direct correlation.
Right.
And over 600, you're taking decades off of your life.
Wow.
Yeah.
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 That's a big
Like,
deal. I mean, pay attention. Really pay
yeah,
attention.
that's a big deal. I mean, everybody wants to talk about longevity and,
Yeah.
jump in a cold bath and,
But if you have hemochromatosis in a cold bath, it's not going to really do you a whole lot of good, is what you're saying.
well, you
Or does
know,
it?
there's probably some benefits to a cold bath, but it's kind of like, why don't you just fix the big problem and not micromanage your health with all these like other things that are like, why don't we just dig up this huge freaking disaster that's destroying your health and get rid of it rather than you like obsessively, compulsively, like trying to micromanage your health. You know
Right.
what I'm saying?
I do know what you're saying. Yes.
Yeah. And so, and I see this all the time with like people in the health and wellness field.
Mm-hmm.
And you know who I really see this a lot? And like I really am trying, maybe you can help me with this. I'm trying to like make an impact and being met with resistance
Yeah.
is I see this in a lot of people that are like on the carnivore diet
Yeah. Yeah.
because they're eating so much
So much
meat.
meat. Hmm.
And when you eat a lot of meat, you are going to have higher levels of iron because there's so much iron in meat and it's so absorbable.
Yes.
And if you're just eating meat, like you're going to have higher levels than otherwise. And maybe that's a good thing because maybe you would have been too low, or maybe you become hemochromatosis, and take off decades of your life and you have a heart attack because you ate too much meat and nobody was watching your iron levels. And so my message, like my whole message to everybody,
Yeah.
regardless of carnivore diet or not, is please just get your levels checked closely and understand what those numbers look mean when you look at them, know what they mean, and get your numbers into a healthy managed range. And if you have a hemochromatosis gene and your ferritin's already in the hundreds or 200s and you get on a carnivore diet, you're probably not the best candidate for that. And keep checking that ferritin. And you know what's going to happen? It's probably going to go up to 300 and 400 and 500. And, it's just going to keep going because nobody's watching it. And sometimes even the people who are watching it just don't understand.
Right.
And
Right.
so that's another part of it. So we've got to get in the right range. And we got to be measuring iron labs closely.
Hmm.
And we got to be getting those hemochromatosis genes.
Yeah. Yeah. What are some symptoms of hemochromatosis? So if people are out there thinking, well, I've never had my iron checked. Do I really need to have it checked? Like what symptoms could I be having?
Yeah, so the answer is yes. Everybody needs to have it checked because high or low, we're going to diagnose it off labs.
Hmm.
But the symptoms can be just about anything. So it can be fatigue. Um, Iron has a propensity to destroy the liver because we store a lot of iron in our liver, and a lot of the ferritin is stored in the liver, which is iron being stored. And so when people have hemochromatosis, they tend to have more liver issues. So there's like a 200 times increased risk for liver cancer if you have
Wow.
hereditary hemochromatosis. So
Hmm.
it's serious. More likely to have high liver enzymes are very common on labs. Um, More likely to have cirrhosis, fatty liver, decreased ability to detoxify, iron also has a propensity to store in the brain.
Okay.
And so you're going to get more brain-based diseases, whether that's bipolar or depression or uh, Alzheimer's or Parkinson's. All of those can and do happen.
Right.
Um, Iron also likes to store in the anterior pituitary gland. So you're gonna get more hormonal issues, it can affect your growth hormone at a young age, so you might be shorter than otherwise. It
Hmm.
can affect your sex hormones, so you might have low testosterone or just abnormal hormone levels. Infertility can affect your thyroid, creating thyroid issues, Hashimoto's, low thyroid cancer. Um, it can it can cause adrenal fatigue. In my husband's case, I think it contributed to him having a tumor on his pituitary gland that caused him to have high cortisol, Cushing's disease.
Hmm.
But that's like an atypical thing, and I don't have a lot of data to say how often that happens, but I just think, the fact that he had undiagnosed hemochromatosis,
Right.
which
Something to think
damages
about.
the anterior, yeah, it's something to think about. Um, Iron likes to damage the heart, causing heart attack, cardiovascular disease, plaquing, stroke, clotting, decreased heart rate, increased heart rate, decreased heart rate variability, just cardiovascular stress. Um, it's you're more likely to get an infection, bacterial, viral, parasitic, period. A lot of digestive issues because iron will eventually start to kind of store and damage the intestinal lining.
Right.
Um, Iron likes to store in the gonads, like the ovaries and the testes, creating low sperm count, low sperm quality, infertility issues. Iron likes to store in the pancreas, causing type 1 and 2 diabetes.
Hmm.
Um, when you start really getting high, it'll start really affecting your skin and like not just increase the risk for skin cancer, but you'll kind of get like this bronzing color sometimes.
Hmm.
So, I mean, really, like some of these hemochromatosis patients, their ferritin's in the 3 or 4 thousands by the time they get diagnosed.
Yeah.
And um, at that point in time, like iron is really, you've kind of become this iron hoarder that's like maxed out every closet and inch in your body.
Right.
And it's just, it's everywhere and it's creating like all this oxidative stress and damage. And so it can look like anything really.
Right. Right. So in other words, just get tested. And if you don't have the issue, then it's something else. But yeah.
And if you don't have the issue, but you have a gene,
Hmm.
then you need to be on top of your iron levels for really the rest of your life because
Hmm.
you could have normal ranges today, and then next year you could have an abnormal range.
Right. Depends on what stress you're under,
Or
what
just
stage of life, or
yeah, like if you, let's say you go through menopause and you stop menstruating, well, then you're more likely to become high in iron.
right.
Or like maybe you used to have a GI bleed and H. pylori and be on like a proton pump inhibitor, and then your gut gets better and you clean up your diet, or maybe, you go gluten free and you have a celiac issue, which is really common with people that have
Yeah.
the hemochromatosis gene, because both of those are in the Irish population largely.
Hmm.
Um, so you clean up your gut and you start absorbing more iron and it goes higher. Or maybe you start taking testosterone, which increases iron absorption and it goes higher. Or, maybe you go on a carnivore diet or you change your diet and you go high and you used to be normal. So the environmental factors are so many, and I try to go through them all in the iron curse, but there's so many, and that's why you have to constantly, everybody needs to be checking their iron levels, but especially anybody that has a hemochromatosis gene.
Right. So is there a difference? I think you've said it a couple different times. There's genetic hemochromatosis and then is there non-genetic hemochromatosis?
Yeah, so there's non-hereditary hemochromatosis. It's kind of funny. In America, we like to call it hereditary hemochromatosis.
Okay.
In the UK, they call it genetic hemochromatosis. It's the same thing.
Okay.
All that means is that you have hemochromatosis, iron saturation over 45%, and a high ferritin with a hemochromatosis gene, and that is genetic slash hereditary hemochromatosis. Okay.
Okay.
Now, non-genetic, non-hereditary hemochromatosis means that, which can also be called just regular old iron overload,
Hmm.
um, means that you have iron saturation over 45%, high ferritin, no hemochromatosis gene.
Okay.
Okay.
That makes sense.
Yeah.
Yeah.
The other thing that's important to know is that there's 3 hemochromatosis genes, and for the third one was really added somewhat recently within the last number of years. And oftentimes people are just getting checked for 2 out of 3. So
Oh,
I
okay.
think that's a oversight that we need to work on.
Right.
Um, and then there is this big myth that I call the carrier myth. And the carrier myth is that there is a large number of people, not just lay people, but like healthcare providers, that believe that you have to have 2 hemochromatosis genes
Right.
to
Yeah.
have hemochromatosis,
Hmm.
and that if you just have one, then you're safe because you're a quote carrier. And that is a load of BS. You can develop hemochromatosis, hereditary hemochromatosis with one gene. It happens a lot. And the way to know is you just check your labs.
Mm-hmm.
So, but there are a lot of people that believe that they are safe. Let's say their parents had it and they're just carriers, is what they say.
Mm-hmm.
And they don't understand that they're not just carriers. They have a genetic risk. It's not as high as having two genes, but they still have a genetic risk, and they're very likely to develop hemochromatosis at one point in their life or another.
Right. I have a family that I know really well, and like everyone in their family has it. So the mom and dad, all three girls, everyone has it, and they have different, variations of, what gene they have and who has what and all those kind of things, but they all have hemochromatosis. So it's in different degrees of it as well. I mean, there's one of the girls is if she doesn't give blood, she feels physically like unwell. And then, another one can go longer. There's just different
Mhm.
variations of it. But it's really interesting to watch and to watch them go through the process, because really, if it wasn't for my friend and she did all her research and kind of fight for it, she would have never really found out what was going on with all her girls.
Yeah, that's unfortunately very common. And that's part of why I wrote the Iron Curse and, created the workshop, the Iron Curse, the video workshop, is because um, I really think that um, in healthcare, there are movements that start from like the bottom up, like the grassroots, the patients.
Yep.
And I I saw this and I see this with celiac diagnosis. Like,
100%.
in my opinion, the only reason that doctors are better about checking for celiac disease now is because they were forced to by
Mhm.
patients who were coming to them and saying, "Oh no, I have a problem with gluten."
Right.
And then, that conversation would often look like this. "No, you don't. Your test is negative. You're fine." "Oh no, no, I can't eat it. I'm sick." Or like they'll come to the doctor's office and say, "Oh no, I'm better. I'm gluten free." And like, "Thanks for nothing, doctor." And I say that, like,
Right.
I've been that doctor, thanks for nothing. You know what I'm
Right.
saying?
Yeah.
I'm not really that doctor when it comes to celiac disease because that's in my wheelhouse.
In your
But
wheelhouse. Yeah.
but I've been that way. Like we've all been that way. We can't know everything. But my point is like there are these grassroots movements where it's like from the bottom up, doctors have to get better and like the system has to change, and it doesn't come from the way that the system's designed to work, where like the agencies change the agencies might decide, oh, now we're going to add the iron panel in the insurance-based model, and doctors are going to be taught differently in medical school, and often that's not how it works. It's
Right.
just like the patients demand better.
Hmm.
um, this is just a trickier one than something dietary related like gluten and celiac, because at some point in time, you often really do need a doctor's help to like have blood removed. Because not everybody can donate blood, and it's
Right.
just like more complicated. You really need more trained health professionals,
Yeah.
which hopefully we'll be getting. There's just a lot of doctors out there that I don't think are fully, I know, don't feel fully, you know, confident in this.
Sure. Makes sense.
So, um, there's something else I was gonna say. So many things.
So many things.
Um, your friend, is she Irish?
That's a great question. I think I know
Does
they're
she have like 8 sisters?
no.
Their small
Just a
family?
brother. Yeah, small family.
Okay.
I don't know if there's Irish. Maybe probably maybe Scottish. I think there's
Yeah.
Scottish in her family.
Yeah.
Yeah.
Okay, so I just want to like nerd out for a second here.
Okay.
So there's like I said, 3 hemochromatosis genes, and there's one that is like really going to cause hemochromatosis much more likely than the other two. So I'm going to tell you the three, and I'm going to tell you like this is the heavyweight, the middleweight, and the lightweight.
Okay.
Because the heavyweight one, if you have two of those, like you are going to have the highest risk for hemochromatosis.
Okay.
My guess is that's what your friend has because she just has to have blood removed to feel okay. And
Mm-hmm.
she's a female, so like she's, been menstruating and stuff.
Right.
So she's losing blood. Um,
Mm-hmm.
so the heavyweight gene is called C282Y. And if you have one or two of those, then you're much more likely to have hemochromatosis because those are the genes that really decrease your iron absorption the most. Okay.
Mm-hmm.
And then the middleweight one, which is the most common in the population, is H63D.
Okay.
And that will also, if you have one or two of those, you're more likely to have hemochromatosis, but it's not quite as high of a risk as the C282Y.
Okay.
And you could have a combination. Like you could have like one C282Y, one H63D. It, it can be anything. Okay.
Right.
Um, and then the lightweight one, the newer one that was added recently in the last few years or so, is called S65C. And that does increase your risk, but not quite as much as the other ones. So
Okay.
it's helpful to know that
Yeah.
because, um, like if you see somebody that has a hemochromatosis gene, like a C282Y hemochromatosis gene, and um, they're like low in iron, then like there's something going on.
Sure.
Like
Sure.
this is not, you should not, especially like a male, if it's like a male that has a hemochromatosis gene and like
Mhm.
he's low in iron, like, and he's not like a vegetarian or a vegan, like what's going on with their gut? Like
Right. Would
what's
you like
wrong?
think celiac? What would you
Or
think for
GI
that?
bleed? Or are
Right.
they
Yeah.
like have they been taking like Prilosec for the last 20 years?
Right.
All of the above, you know?
Mm-hmm.
Um, so I think it's really helpful to have the genes because it helps you to like make sense of why and
Right.
okay, this doesn't make sense or this does make sense.
Mm-hmm. Yeah.
So yeah,
Every time I talk to you, I'm like, "Oh, I need to do more genetic testing."
yeah.
Yeah.
And it's intimidating for like and I have studied genetic testing a little bit and there's just so much like I get intimidated by some like I don't know. People
I
ask me
don't
about all
know.
these
Yeah.
genes. I'm like, I don't know. Like just
And I
because I
don't
know
want
about
to, I don't
some
want to go down a
genes,
rabbit trail, I don't
yeah.
want to
Yeah.
get
Just
focused off.
because like I know about some genes doesn't mean I know like everything about every gene.
Right.
And like nobody does because we don't know it. But what I think what I think I've learned over the years from looking at people with looking at people's genes, looking at their labs, looking at their family history, looking at their symptoms, studying about those genes, writing about those genes, all of that. What I've learned is this. Um, there are a handful of genes that everybody needs to be testing for. And the hemochromatosis genes are in that handful.
Mm-hmm.
And so you don't have to know like everything about like 100 genes. You really like, if I really dial it down, you really need to know a lot about maybe 20.
Mm-hmm.
And that's very doable. And that's what I have tried to, I don't know if you're, I don't know if you've taken any of these workshops, but last year I spent like a lot of time and energy creating all these workshops that talked about, I called them lab genomics, and it was like looking at labs and genes and case histories and like the research.
Right.
And and what I really tried to do was like, if I didn't talk about a gene in those, I didn't talk about a lot of genes. If I didn't talk about the genes in those lab genomic workshops, like you don't need to know about it.
That
Like
makes sense. Mm-hmm.
just focus on those. And then in the iron curse, I talk about a lot of different genes, mostly the hemochromatosis genes, but maybe like it's 15 genes. Like if you just look at the genes in that book and
Mm-hmm.
study those genes, like you will be way far ahead of most people because in the last part of the Iron Curse, the book and then the workshop, is I talk about genetic combinations. So Like one genetic combination that's really important is the hemochromatosis gene with the Alzheimer's gene,
Right.
because hemochromatosis by itself is going to increase your risk for Alzheimer's. And then if you throw in the Alzheimer's gene on top of that, you're at a much higher risk, simply because now you don't just have the Alzheimer's gene that is increasing your risk, but now you have this high iron situation. And so if you have an Alzheimer's gene and a hemochromatosis gene, there are steps you can take, and I outline in my books and workshop those steps, what you can do to like avoid
Avoid.
those issues.
Yeah.
And the sooner you know, the better.
Mm-hmm. That's awesome.
So yeah.
Yeah.
You just have to start somewhere.
Yeah.
And there's a lot of different genetic testing companies out there, and I don't like have the one that I have the most experience with is 23andMe, and there's two reasons for that. And this isn't me trying to like sell them. This is just why I have the most experience with them. They were first, they were the biggest. They, in some ways, like created the industry standard.
Sure.
And for that reason, they are the most popular that people have already done.
Right.
And so it's nice. You need to be familiar with them simply if you want to know this stuff, you need to be familiar with them simply because so many people are going to come in having already done that. And that's really nice to like your first appointment be like, have you done 23andMe? Yes. Okay.
Mm-hmm.
Let's look at this and figure it out. Rather than having to, like explain to them why this testing should be done, getting it done
Sure.
6 weeks later, whatever, looking at it. So that's one reason. They also like pretty affordable compared to a lot of other options for what you get.
Sure.
Pros and cons. And then I created the genetic detoxification report, and that report you can download 23andMe or self-decode raw data, and then you can create that genetic detoxification report, which will tell you about like many more additional genes than what those genetic
Right.
testing
Right.
companies would tell you about. So because I created that report and I like it and it's easy for me to understand, and I try to make it easy for people to understand, I use it a lot. So, but it doesn't have to be that. There's other options. The key is that you know what the genes are. Here's what I really don't like. When I see a genetic report and they just say like low risk, high risk, but they don't like actually give me the genetic type. Do you ever see that?
I do see that. Yeah.
I can't
Like, that
stand that.
doesn't tell me anything.
Yeah, to me, that's like somebody giving me lab results and it's like cholesterol, low risk for heart disease. I'm like, I don't
Right.
freaking care what your risk calculator says. Give me the numbers. Give me the data. I don't
Yeah.
care about
Yeah.
your whatever BS.
Yep. 100%. Oh my gosh, man, we could talk about this for hours, but we
But
do
who
have
would
to
want to
wrap it
listen
up.
to that? That would
Who would
be,
want to listen to that
we want to
forever?
up
Maybe.
your ratings, not lower them.
Oh my gosh, Christy, this has been great. I appreciate your expertise,
Thank you.
your sharing everything with us today. Wonderful talk about the iron curse, and all of Christy's information will be down in the show notes. So check out our workshop. It's phenomenal. Check out the book. It's amazing. And we'll probably have her on again. So until next time, Christy, thank you so much for being here.
Thank you. Bye.
Appreciate you a lot. Thank you everyone for listening. God bless. I'll see you in the next episode.